My name is Derek Mitchell. I'm a general surgeon with a special interest in the care of women with breast cancer. It's a major problem in Jamaica. It's the second leading cause of cancer deaths, and it's second in incidence only to cervical cancer. I must add that cervical cancer is a problem that seems to be well in hand because of the long practice of screening that we've done both in hospitals and at the Cancer Society. With breast cancer, on the other hand, we are not so fortunate, and the screening efforts are not as successful. One of the problems is that we can't identify breast cancer at a stage before it is breast cancer. So our hope is only to find it at an earlier stage, because the earlier you find it, the more options we have when it comes to treatment, and the better the outcome. Once you have a breast, you are at risk, and that it affects men and women. Clearly, women far more so than men. For every man that would come down with breast cancer, we can expect roughly 100 women to come down with breast cancer. Clearly, if you've had breast cancer before, you have a much higher risk of developing breast cancer on the other side. And if you have sisters, mother, or daughter with breast cancer, it also increases your risk, especially if those relatives are under the age of 50. There are other things, the nulliparity, that means the women who never get pregnant also have increased risk. And we believe that is because they have a long, unbroken period of stimulation from the ovaries, and this increases their risk. So we generally would prefer that women would have their normal pregnancies in an attempt to reduce their risk. And we know that the earlier they have these pregnancies, it's the better for them. There is a small association with obesity and breast cancer, but mainly for women who become obese after menopause. As far as detecting cancer at the earliest stage, it depends clearly on the age at which the woman is. We would prefer that women in their 20s develop a habit of examining their breast. And the best time to do this is once a month, about a week after the menstrual period ends. We don't expect you to get breast cancer in the 20s. It does occur, but it's extremely rare. But the idea behind it is that between the age of 20 and 30, you become an expert on the way your breast looks, the way it feels, and if there are any new changes, you would be in the best position to detect them at its earliest stage.